Start now. Hi everyone. Good morning. We are honored today to have Dr. Baaj here with us. Dr. Baaj is a board-certified spine surgeon. He is a fellow of American Association of Neurological Surgeons, former chief of spine surgery at Banner Health, and now he's taken a new role as professor, vice chair, and director of spine technology, innovation, and fellowship programs at Northwestern Neurosurgery. A fellowship-trained spine surgeon with over 150 publications and co-editor of four spine textbooks. Dr. Baaj is passionate about mentoring international medical graduates and providing opportunity for global trainees to pursue neurosurgical education in US. He's a founder of the Virtual Global Spine Conference, launched during COVID. He has revolutionized global spine education and built clinical collaborations worldwide, from Boston University to Johns Hopkins to leading spine programs. Dr. Baaj exemplifies surgical excellence, innovative education, and dedication to advancing international neurosurgical training. Dr. Baaj, we thank you for being here with us, and it's a great honor.
Thank you. Thank you, Matthew, to you and to your other colleagues who have put together really this nice initiative to, just to expand access to educational material, awareness among medical students in the U.S., but, to be honest with you, even more importantly, outside of the U.S. So thank you. Thanks to all of you, each one of you, for doing this, and it's a pleasure to be here.
Thank you, Dr. Baaj. I want to present our panelists today. My name is Matheus Amarish. I'm a fourth-year medical student at Rio de Janeiro. We are here with Carlota, who is a medical student at Italy as well. We have Bernardo Nogueira, who is a medical doctor, and Pedro Borges, who is a medical doctor as well. So, Dr. Baaj, to start this webinar, I want to invite you to take a few steps back and reflect on the past, before the Dr. Baaj era. Can you tell us what Ali Baaj was like during college and med school?
Yeah, no, that's a good question. You're gonna take me back many, many years, but that's okay. When I was in college and medical school, I don't think, I wasn't one of those that, like you guys, you want to be a neurosurgeon from day one. You're doing all of that, trying to get there. For me, it wasn't like that. My journey actually started in doing research with a cardiothoracic surgeon at Boston University. Boston is my home. I went to all of my schooling from middle school all the way to medical school there, so I consider that home. I knew I wanted to be in medicine. I was fascinated by honestly by cardiac surgery because I had some family members who were that. So my first research was in cardiac surgery, and at BU, and just like you guys are all doing, spent some time doing that, getting to know people, doing rotations, and to be honest with you, just very randomly in medical school, during the rotations, I was placed to shadow a neurosurgeon there, who is a pediatric neurosurgeon actually. And I said, sure, I'll do it. It's 6 weeks, learn something new. And that really that proved to me to be one of the most exciting rotations I've had in medical school. I said, wow, I didn't really know that much about neurosurgery or that field. And of course, he was a great mentor, an inspiring mentor. He was very he was always in a good mood. He was smiling. He was great with his patients. And it's just one of these moments where I was like, you know what? I want to be like him. I want to be like Dr. Ordia. His name was Joe Ordia. And I made a pivot, and I said, I'm going to do all I can to get into neurosurgery. And that's really where my path began. And I had to quickly catch up, and And here we are. I graduated medical school in 2004, so here we are about 21 years later. But it's been a great journey. It's very rewarding. In medicine, as you all know already as medical students, but as you will see in training and when you become clinicians, it's really a pleasure and a privilege and a responsibility to take care of patients, no matter what field you go into, whether it's neurosurgery or neurology or cardiology. But certainly neurosurgery has been very, very special, both during training and now in practice. So that's how things started out for me back in Boston and Boston University.
Thank you for your answer. It's great. And I would like to change a little bit about the topic and once again say that it's an honor to have you here with us today, not only because of who you are, but all the projects that you created and lead. And for those here that who may not know, Dr. Lee Baaj is the mastermind behind Virtual Global Spine Conference that promotes weekly sessions and bring together world-class spine specialists to discuss some cases, give some lectures. And I think in some ways it mirrors a little bit what we're doing here in Med School Mentor, trying to make mentorship and high-level education accessible for everyone across the globe. So I would like to ask you, what was it like to be on the forefront of one of the first truly global virtual initiatives that connected so many leaders in medicine and basically bring them into people's houses and living rooms, you know? And how did it feel to unite those incredible minds and also create basically a living network of interaction, education, and mentorship?
Yeah, thank you. Thanks, Bernardo, for that question. Obviously I really enjoy talking about this specific initiative because it really was very special and it continues to be. And it began at a time that was, to be honest with you, in what is it, 2020, in March 2020, which was a very dark time for a lot of people and a lot of us. And actually at that time, I was in New York City, in Manhattan, at Weill Cornell Medicine. And in the United States, if you remember, 2020, New York City and Manhattan was the epicenter of the pandemic. And we really couldn't do anything, right? You can't, there's no surgeries, there's no clinics. The academic conferences were basically halted. Um, and so I always tell people the one thing I'm most proud of is from that era of darkness came this really light in terms of education and in terms of global collaboration. And that's really probably what I enjoy most about. I do have to give a lot of credit to the phenomenal other colleagues that helped me with it. This was not a one-man show, and it's still not. Um, but it's as simple as, just, I put this every year on the anniversary on March 25th. Every year on the anniversary, we're now getting into year six. It really started out with a social media tweet, right? At that point, before X, it was called Twitter. And it was just a tweet saying, you know what, it's March, there's COVID, nobody's doing anything in terms of conferences. Why don't we put together a virtual conference, right? A virtual case conference, really. And the idea picked up. The idea picked up steam, and a lot of people, of course, because we weren't very busy in either surgery or in clinic, they bought into the idea. And we were all new at this thing called Zoom, which, of course, many of you are very good at it now. But in the beginning, I was one of them. We were just learning how to use Zoom. And we said, you know what, we're going to do this every week and let's see what happens. And if the funny story here, or maybe not so funny, some of you may know or may not know this, but we were very excited about launching the very first session. We had hundreds of people. At that time, we had hundreds of people join for these webinars. And literally like 10 or 15 minutes into our very first inaugural session, we get Zoom bombed. I don't know if you remember what the word Zoom bomb mean. Thankfully, it doesn't happen that much now, but initially when everybody was figuring it out and we really didn't know how to set the security parameters and the passwords and all of that, we got Zoom bombed by just, a lot of bad things on the screen. And it's like, how do we turn this off? How do we cancel this? And then we all thought this was going to be it and we're never going to do this again. And I even got text messages from friends like, oh, great idea, great try, you did your best. And one thing you will know, all of you, since you're hopefully going into neurosurgery, is that, neurosurgeons don't take no for an answer, right? We don't fail. We just keep doing it until we succeed. We got to get it right. We don't give up easily. We're persistent and resilient. And I said, no, just because that happened, we're not going to shut this down. Um, and we got back at it. We learned a little bit more about security and how to make these sessions safe. And here we are, getting into year 6, and we still run the program every Thursday live on Zoom, with really a global audience. So the story is really fascinating because it came at a very dark time, but then we realized quickly that we really are helping a lot of students, trainees, and in many cases, other surgeons throughout the world. Anybody who has access to the internet, it's a free service. It's independent, and it always has been. It's not affiliated with any university. We don't receive any funding. It's not tied to industry. It's just, anywhere between 5 and 7 faculty, and also a phenomenal student fellows who actually helped us throughout this time running the logistics. We just put this together and we said, this is something that is very meaningful to people. And just like you said, Bernardo, what's special about it is we literally, especially in the beginning, I would say a little bit more than now, because now everybody's back to their offices, of course, and work schedule. But we were bringing experts and leaders in neurosurgery, orthopedic spine surgery, neuroradiology, literally to people's kitchen, right? I mean, if you had a computer in your kitchen or your house, and there you are, you're listening live to somebody, you can chat with them, you can ask questions directly. It actually, in a way, was much easier and much more streamlined to engage with these experts than you could at a conference, right? Where you have 200 people and you're shy, you don't want to stand up and ask a question, you don't know if you'll have a turn. But all of a sudden, we gave access, um, to so many people, so that they can engage with these experts face to face in a very safe and controlled environment. And I think that's why it was so successful. So it's I don't know how long we're going to do this for. I always tell people, maybe at 10 years we'll just close it down. But I really don't see a need to close it down. I think right now, although we don't have hundreds of participants every week online, but when, like, I think like you all are doing, when we record these sessions and put them on a YouTube channel, hundreds and hundreds and hundreds of viewers over time. Because remember, they're also in different time zones, and the time zone where we're running this, just like this is today, that's not necessarily convenient to folks in other parts of the world. So it's been a great project. I'm very, very grateful to the wonderful colleagues, orthopedic spine surgeons, neurosurgeons. We have Dr. Gibbs, who's our neuroradiologist on the group. Just a great group of people that are dedicated to education, training, and this collaborative sense that we could do a lot more together, as a group. And it was an eye opener. It was an eye opener, just like you all are doing now. That the power of global collaboration brought together in a virtual teleconferencing platform was very nice. And not to mention, we were lucky enough to get 2 peer-reviewed publications in World Neurosurgery about this experience. So that gave it a little bit more credibility, and gave it a little bit more, I would say, turned it from, from just a meeting online to a really a scientific initiative, which we're very proud of. So that's a virtual global spine conference.
Thanks, Dr. Baaj. Ankush made a really interesting question. I just want to point out that I'm reading his question later on because we are going to enter this topic. Now I'm going to pass the mic to Carlota.
Hi, Dr. Baaj. Thank you again for being here. In one interview from Becker Hospital Review, you talk about how academic medicine often remains confined within what you call an academic bubble. So, beside your experience with COVID, was there a turning point in your experience in your career that made you consciously step outside that structure and begin engaging globally, not just clinically, as a mentor and educator? And what challenges did you encounter in bridging the gap between academic medicine and broader global engagement?
Yeah, great question, Carly. I think a lot of us as, clinicians, as very busy neurosurgeons, it's very easy to just, like I said in the article, stay within a bubble, right? This is what I do, this is what I know, this is how I do it, and that's just going to be the way it is. Um, but then, in academic medicine, we have the luxury and the responsibility, by the way, to get out of that bubble, to visit other surgeons, to engage in different associations and communities, go to conferences, regional, national, international. So we learn new material, we teach new material, and we engage in that scientific exchange so we can bring that information back to our hospitals, to our clinics, to our patients, to our trainees. That's really one of the responsibilities and privileges of being an academic neurosurgeon. And I think, I was in, I was in academic programs right out of training, so that's really all I know. But I realized very quickly that, there is more than one way of doing something. There are other people who practice differently and operate differently and research differently. And that came with visiting different surgeons and engaging in different conferences, whether it's in Latin America or Europe, the Middle East, Asia, not to mention, of course, North America. And I think that's where that came from is it takes time, it takes energy, it's time away from family, it's time away from practice to go to these conferences and go to these meetings. But that's how we expand our knowledge. That's how we broaden, if you will, the horizon of what we know and what we should know so that we can enhance the experience back home for our students, for our trainees, for our patients. So the turning point for me, if you will, it wasn't necessarily a specific day or time or year. It started definitely before the pandemic, but there's no question that since the pandemic and since we did virtual global spine and since we were doing a lot of these meetings online, it was very obvious that we have a great opportunity to really expand our knowledge base and expand um, really our expertise by learning from other colleagues. And therefore, I make it a point to collaborate with other folks, regardless of where they are, on my manuscripts, on the books that I publish, on the webinars that I run. I really do believe in the power of many over the power of one. And I think for us as neurosurgeons, that's really important because there are not that many of us. There are not that many neurosurgeons or spine surgeons for that matter, whether it's in the US or in the world. And therefore, why not leverage the expertise and the knowledge base of so many to enhance our own practice and our own fund of knowledge?
Okay, thank you so much.
Dr. Bash, so we are in an era of academic productivity, and it's often becoming the primary metric for success. So, how do you see this when you are choosing for a resident, when you are like trying to analyze some candidate? How do you see this academic productivity?
Yeah. I mean that's an important question. I think that's a really good question, especially for your audience. I would imagine a lot of your the listeners either today or who will watch this later are medical students or pre-residency fellows or students. And the question is how do we gauge who's going to be a good resident, right? How do we get, what are the qualities in terms of academic productivity and other ways to become successful? So number one, I think the number one most important item, which I know all of you, because I follow all the work, the great work that you do online. The number one thing is reach out for mentorship. Reach out to surgeons, to educators, residency program directors, faculty, um, so that you get a firsthand glimpse of what they're looking for and what their program is like, and what does it take to be a successful candidate. And the reason I think that's really important is because I learned the hard way. I didn't really, when I was younger, in college and medical school, I was one of these people that said, "Oh, I know how to do this. It's very easy. I don't need to talk to anybody about it." And that was not right. It took me much longer to actually get into residency and do what I ended up doing because I didn't seek that mentorship early on. So it's really important to talk to faculty, email folks. I know that everybody's busy. I'm guilty of sometimes not being able to email back right away, but we all try. Many of us who are in academic neurosurgery, uh, do it for a reason. Do it because we do believe that helping and mentoring and inspiring the next generation is important to us, our field, and our patients. And many of us really believe in that. I mean, that's one of the reasons I'm here with you all at 8:30 in the morning on Monday, because I do want to see all of you succeed. We do need great people in this field, and the onus is on us. So number one, seek mentorship, talk to faculty who can give you good advice. That's the overall message. When it comes down to, okay, give us a little bit more specifics. What does it take? We everybody really looks for a well-balanced candidate, well-balanced applicant, right? It doesn't do anybody any good if somebody has been extremely productive, say, as a medical student or as a fellow, with dozens and dozens of publications and this and that. But on the other hand, they're not balanced in other ways. Whether it's interpersonal skills, whether it's hobbies, whether it's communication skills, so on and so forth, clinical experience. So they're different. It's, really my one message is that the applicant has to be well balanced in terms of productivity, in terms of good mentorship, letters of recommendation, um, engaging with faculty. In this case, let's say if you're outside of the United States and you want to pursue training in the United States, make an effort, if possible, to come to the U.S., visit centers, do some internships or externships, rotations, either clinical or even as an observer, because that also gives you an opportunity to look at the different types of programs and see where you think you would be a good fit. There's 150, 160 plus programs, and they're all very different. And you want to make sure that that you see yourself training there. So yes, academic productivity is important, but let me put it this way, it's necessary, but not sufficient, if that makes sense. And by the way, the other attributes of an applicant, your scores, your USMLEs, your letters of recommendation, each one of those are absolutely necessary, but they're not sufficient. All of them together become that full, sufficient, excellent package that will prepare you, hopefully, for a good process and a successful process of matching.
What we see is even to get a chance to make an interview or try to show your other qualities besides statistics, besides research statistics and grades, you have a filter. You have a filter to pass, and that's the real challenge, like to pass this filter and get a chance to be interviewed, and to get the interviewer to know you more personally, So asking in that way to try to jump this filter Not talking about research quantity that we are seeing that is increasing. How do you think that a candidate can try to naturally pass this filter without boosting up publication volumes and doing stuff like this?
Yeah, yeah, that's also a good question. And you know, you are right, Matthew. You are right. There are filters. There are filters that are, you know, sometimes written, and often they're actually not written, and you don't even know what those filters are, but they exist, right? Um, and I would say, you know this, and certainly I know this from practicing over 15 years and mentoring dozens and dozens of students and fellows who have very successfully become neurosurgical residents, is although there are obstacles, although there are challenges, um, every single person does have a chance. Every single medical student, every single applicant, regardless of where they come from, have a chance. Okay, so the starting point is, the default, I would say, is yes, it's possible. Nobody starts out by saying, well, you know what, this is not going to happen. Now, if we start out by saying this is possible, now let's look at the details. Let's look at how one did in college, in medical school. Let's look at their research experience. Have they presented? Do they have abstracts? Do they have publications? Do they have any either research or clinical experience in the United States? Let's look at tests and test scores. When we put together all of these things, and I think those all together are the best way to basically overcome those obstacles or those filters. And of course, at the end of the day, let's say somebody has, everything looks perfect on paper, right? Everything looks perfect on paper, but if the faculty or the residents or the team doesn't feel like they can, work with you or talk to you, or they don't sense that you're really passionate about this, then that's going to take you down a few notches, right? So that's why I'm saying it's really a complete package. There is a way to overcome certain obstacles. But you have to be intentional about it, and you have to really pursue those opportunities. And just very, very honestly, I would tell this to you, and I know some of you already know this. I would say, since I see a question here about IMGs, if you're an international medical graduate that wants to be successful at matching or entering neurosurgical residency in the United States, you know you're going to have to dedicate between 1 to 3 years on average. On average, sometimes it's very quick, sometimes it's more. You have to dedicate 1 to 3 years to do all of that, to get the correct research, to find the right lab, to find the right mentor, so that people get to know you, the program gets to know you. And sometimes that's all it takes. And sometimes you'll do all of that, and you or the program or your mentors will have a serious talk and say, you know what, maybe neurosurgery is not the right path for you. Let's find you something that is, more better suited for your skill set, for your experience, for your future direction. So I think having a very, very honest discussion with a faculty or a mentor that's going to be honest with you and transparent is very important. I have this where I talk to a lot of other colleagues who talk to students, and I always tell them the same thing. I say, you know what, you've got to be very transparent and honest with somebody about what their chances are, what they're lacking, what they need to focus on, how can they improve their chances. It's not just like, oh, good job, I'm sure you're going to do great, let's see what happens. That's not enough. You need specific feedback. You need specific points about what are my weaknesses? What are my strengths? What do I need to do to get there? Is it possible or is it not? And that way you can make a calculated risk and a calculated guess, if you will, about what you want to do in the next year or 2 or 3 or 4, right? I mean, I'll give you a very extreme example, right? I mean, if for one reason or the other, you just were not able to get good scores on tests, you really don't have much research experience, you've never really had any clinical or hands-on experience in the US, and the application is just not very strong, you know, you're going to just need to do a lot more to get there, right? So it's not fair for somebody to tell you, oh yeah, you should just submit to the match. Let's see what happens. I'll tell you what's going to happen. Nobody's going to look at that. You know, no, you're not going to be invited for an interview. So I think you all deserve a very honest and transparent assessment of your candidacy and your application to identify what the weaknesses are and what the strengths are. But I will say, and I mean this from the bottom of my heart, nothing is impossible. There's always a chance. You always have an opportunity. But all of those factors that I was discussing earlier, you have to put them all together, and that determines where you are on that possibility scale, if you will. And certainly all of you have my email. I'm happy to provide feedback or talk to each of you individually. I'm sure you all have phenomenal mentors as well, but that's a very long way of answering your question about how do you assess an applicant, especially an international medical student or graduate? The answer is it's very complicated. It's fair, it's very fair, but it's very complicated because it depends on so many factors. Other questions?
Thank you, Dr. Baaj.
Thank you, Dr. Baaj, for that very comprehensive analysis. I guess one thing that I would like to follow up with you on is you mentioned how some people will go through 3 years of research, and that may range. The success that they may get from that will also range. I guess my question is, what do you recommend to someone who has gone through that process and has not matched in their first attempt?
Yeah, that's a great question, and that's a very common scenario. That's a very common scenario. So I'll give you a specific example. I've hosted over the last years, the last 10 years, actually more, 15 years now, many students, right? Many students from all over the world. And what I tell them is this: you want to give yourself and position yourself in the best possible situation for a successful, obviously, match, right? So, that saying, if you do the same thing over and over, but expect a different result, that's the definition of insanity, right? So if you're doing, so let's take a look of what the issue is. Is it that you've done 3 years of research and you just have, that your scores on tests or your performance on tests was not satisfactory, or you're the type of person that maybe needs a clinical hands-on experience, or maybe you're the type of person that needs a little bit of coaching with interviews and how you communicate during an interview. In other words, not knowing anything else, Pedro, about that candidate, not knowing anything else. If somebody tells me, hey, Dr. Baaj, I've done 3 years of research and I have not been able to match, I will guarantee you my answer will be, you do not need a 4th year of research. Something else, you've got to do something else. We have to find out what it is that's missing. I mean, if you've done 3 years of research and you have 0 publications, that's a problem, right? But if you've done 3 years of research, you've got some good publications, maybe, 8 or 10 or 12, you've done really, good work, but I hope I don't get in trouble for saying this, but let's say the 3 years of research were in a program or in a hospital or with a center that, nobody knows anything about. They don't even have neurosurgery program. They're not tied to anything. The mentors aren't connected with anyone. It's like, where did you do the research in, right? Like if I guess what I'm trying to say is doing 2 or 3 years of research is important, but just as important, where did you do them? Who did you do them with? Who were you exposed to? Who are the people that saw you and can really vouch for you and write you a great letter of recommendation that other people are going to take seriously and say, wow, well, if Dr. Baaj said this, then maybe Pedro really is amazing. Or, yeah, I mean, I'm not saying, whether it's me or somebody else, but it's you have to look at the whole package. And if somebody did 3 years of research and is not successful at matching, we've got to look at why. It's either where they're doing their research, who they're doing their research with, or it could be as simple, and this happened to my fellows too. It could be as simple as, you know what, you've done great, you have your publications, you have your abstract, you have your research. Now I really think you need to do a clinical year. We have to get you into either a pre-residency fellowship or a PGY1 prelim intraneer, so that others know that clinically you can you're up to the task. Does that make sense, Pedro? Okay, let's do maybe a final question.
Yeah, that makes perfect sense.
Okay, so I just want to ask you, you have trained across institutions that represented very different culture of neurosurgery education, from Boston and Barrow to Johns Hopkins, and now to Northwestern. What have you learned from these systems about how surgical excellence is cultivated? And now that you're stepping into a major leadership role, how do you plan to bring those lessons into your own approach to training the next generation of neurosurgeon?
Yeah, great question, Carly. I mean, you're right. I've been at I've been very fortunate to be at several institutions and really learn from a lot of my mentors there, a lot of my chairs, a lot of my partners, even my residents and fellows. And you'll see this too, right? I mean, whenever you have that experience from multiple places, you are able to bring it together and fine tune it. But you're right, every place is different. There are different demands, there are different expectations in each program. But I'll tell you, I feel extremely lucky to be here. I started this in this new role just again just within a day or two, and I think in this phase of my career, over the last 15 years, obviously I've spent a lot of time building successful and busy practices, which my intention is to continue to do that here. But certainly in a really world-renowned institution like Northwestern, and a very iconic city in America, in Chicago, with all the resources here and really all the just all of the energy here in this institution, in this medical school, in this health system. I think I'm very excited to leverage what my passion and my expertise and my background to helping as many people as possible, whether it's on the patient side or certainly on the training side, on the medical school side. There's a very impressive medical school here, the Feinberg School of Medicine. And of course, we have one of the, a very large residency program with three residents per year. There will be spine fellows, there are cranial fellows. I mean, it's a really full package, comprehensive program. So I feel very lucky. I feel that after all these years, I'm finally at a place where everything's coming together, so that I can really do what I enjoy doing, which is things like this, operating, seeing patients, helping patients, but also having the ability to really empower and inspire so many trainees and students. So I'm extremely excited for where I am and hopefully where I'll be able to go here at Northwestern.
Thank you.
Great. Well, thanks everyone. This
Dr.
has been absolutely great. Again, congratulations on a phenomenal initiative. Having run these webinars before, I know they're not easy at all, and there's a lot of work that goes into them, but I promise you it's very important work. A lot of medical students all over the world need to hear these, need to hear your stories. They need to hear the stories of your guests like me, because a lot of people don't have access to this information, and I really congratulate you for doing this work. I know it's not easy, but it's something to be very proud of. So congratulations to you all.
Dr. Baaj, thank you for everything. I want to point out that we are extremely honored to have you here. And for us, this is a really life-changing moment. We are like from other countries. We are here. You are giving us your time. You are everything that med school mentor stands out. You literally are passionate about it. You make yourself available. So I want to point out that it's really important to have people like you. We are really grateful and thank you for everything, Dr. Baij.
Yeah, of course. Pleasure is mine. And if I usually make it a point to meet with students and and fellows and all of and you know different trainees, especially during our big meeting. So if any of you are coming to the CNS in LA in October, it would be great to see all of you there, and we can talk more in person. Otherwise, you all have my email. Please reach out anytime.
Thank you, Dr. Baaj. It will be a pleasure. We are definitely going to cross our path again.
Wonderful. All right. Thank you all. Bernardo,
Thank
Pedro,
you.
Carlotta, and June. Thank you guys all, and have a great rest of the day.
Thank you.
Bye-bye.
You too.
Bye. Pode parar a gravação, Fernando.
Tava com a Carlota a gravação, ela saiu.
Ah, tem que falar com ela, pronto.
Bernardo, tem que fechar o seminário aí.
Tá com a Carlota. It's with Carlota, the webinar. I can close it with the other account.
Just to answer your question, yes, we are going to